Hello and welcome once again to our podcast, the Just Massage Therapist podcast, where we are just massage therapists, just people, just whatever it is that we are and do. We are just that, and these are just our opinions. As you can tell, I am by myself, and I will be by myself today. This will actually be a bit of a shorter live than normal because I don't have my co-host, so there's not going to be as much to talk about. Today, we're going to be chatting principles of massage and some of the things behind it. Although this will be a pretty short one, I'm sure we'll do another one of these with Cora when she is here, but she is not here with us today. Welcome in. Thank you for joining. If you are watching this after the fact, thank you for watching this after the fact and hanging out with us. And you can ask us any questions that you want. I don't mind noises in the background, they happen. So, principles of massage. Now, everybody, at least everybody from where I'm from, when they hear the words principles of massage, they immediately go to the 4 or 6 main principles that we follow. But before we talk about those, I actually want to talk about what I consider to be the precepts of massage therapy. So the first things that you always have to have in your mind, and the last things that you will think about before you fall asleep when you're a massage therapist. It's just one of those. This should always be on your mind in every decision that you make. The first one of those is safety. Safety first. It will always and forever be about being safe. Safety for your clients, your patients, safety for yourself, for your working environment, for your clinical experiences. Safety is key. It is number one. It is the big thing that we always want to keep in our minds. And honestly, most of the time that's really not difficult to do as a massage therapist. We're fairly confident and comfortable with many of the major contraindications, if not all of them, depending on how long you've been treating for. Pretty good about keeping your spaces safe and cleaning and knowing the difference between sanitizing something versus actually cleaning that thing. Sanitize is like just an overarching word that says it's been cleaned to some degree, but if you want to actually clean it, you do much more. Like the term for cleaning is different than the term for what is that word? When you really, really, really clean something. Sterilization. Wow. Could not remember the word sterilization, guys. Yeah, that's pretty funny. Anyway, so with that safety, going back to just the topic there of safety, is the first thing we want to think about. Do no harm, right? So we want to be safe with our clients. We want to make sure that we're picking out the techniques that are going to work for them and not against them, that we're doing good flushing, that we're not going too deep too quickly, right? So we want to keep in mind that for while we're treating our clients, what positions are going to actually work for them and not be uncomfortable or creating pain. Discomfortable, that was an interesting one. Creating pain or discomfort is what I was trying to say. Whew. It's going to be one of those nights. So one example for that is I've known a number of people who can't actually lay what we call supine or face up on the table for any length of time because their legs will start to go numb, specifically the lateral portion or the outside portion of their thigh, right? That femoral region, that lateral femoral region there. If that place starts to go numb because of being in any sort of position, we know that there's a cutoff of a nerve. And if a nerve is being smushed, we really don't want to be putting them into that position. We want to find out what's going on and see if we can help them or if there's any help to be had for them somewhere else, right? But safety matters first. We take care of the unsafe circumstance first. It also travels over to safety for us, the massage therapists, right? So as a massage therapist, I need to create some safety rules for myself. One of those big safety rules for myself, and should be, is making sure that any cuts, scrapes, either on them or on myself, or are not interacting ever. Currently, I have a little cut on my finger. It's really dumb, cardboard cut, stupid story. I would 100% be putting on gloves or a finger cot over this because I don't want any of the bacteria that lives on them or is hitching a ride on them to get into my bloodstream through my cut. And vice versa. If they've got open wounds, you don't touch them because you don't want to move any of your bacteria, or the bacteria that's catching a rat on you, or even their bacteria or other bacteria that's catching a rat on them from other areas that you're now transferring over, right? You don't want to do that. Safety also includes washing the hands a lot, like a lot. We do a lot of hand washing all the way up to any place that's going to actually be covering, and taking care of your tools, right? For instance, I just got these. Just got these the other day, right? They came in, I played around with them, right, after cleaning them out. And then when my husband got home, he has tennis elbow, so went in there, had some fun, released some stuff, felt better. I don't know if it still feels better. I haven't asked him since I did this a couple of days ago. I will. But then as soon as it was done, go, you clean them, you make sure that they're dried properly. Yeah, so these guys are good to be used again. Just, general hygienic stuff is all part of that safety, right? So that is really like the big thing, number one thing that we think about. The second thing that I generally will say before we get to the the normal principles that most people think of when you say principles of massage. The next thing is the care of oneself and the care of the client as an individual, right? So taking care of myself outside of the hygiene stuff, I need to make sure that I'm okay in order to be able to treat people, right? So making sure that I and my well-being, my cups are full, my body is fresh, I'm very grounded, and I'm not bringing anything that might be bothering me to my clients. That's my next thing that I think about. And sometimes I'll do that with grounding techniques. If it's warm enough outside, I'll ground myself outside. If it's not, then I can still envision the grounding in my head, in my space, but prefer to do it outside in the actual grass or soil. So I'll ground myself and make sure that anything that might be seeping through is satiated for the moment. And then just, making sure that I'm doing my own strengthening and stretching routines. I'm not as good right now because I haven't been treating in the past little while. Unfortunately, all of my exercise starts to dwindle when I don't massage, which not good. Don't do that. I will do my best to get better at that as well. But yeah, you're making sure that your body is taken really good care of. You're drinking lots and lots of water, but not like so much that you have to pee yourself every 5 minutes. That's not good either. And then it's looking at the clients. Next part is that looking at the clients and doing what's best for them as individuals. Right? So individual client care is supremely important, and not trying to look at each client as, number one, a paycheck. It's an awful way to look at your clients. Or number two, like every other client you've seen with this particular condition, thinking that you could do just the exact same thing. There are some steps that we all can take and techniques that we all know or don't know if we have some techniques that are different. But each client that comes in, each patient that comes in, needs to be looked at as a individual and needs to be treated as such. Now, I know that most massage therapists, if not all massage therapists, they get this. We can kind of move on from that, but it's sometimes you get into a routine and you kind of forget, and you just do your routine on your client for an area, and you're used to doing that routine, but that routine isn't what they need in that moment. Sometimes we get just into that mode. So I'm just reminding you, if you've been stuck inside of that mode where you're just going in, doing the exact same thing on people all the time, and you're not truly thinking about, is this going to work on these areas? Just a gentle nudge to think about, going, is my normal treatment going to actually work for this particular individual? Do I need to make some adjustments, some changes to the way that I even just set up the room to make it a more individualized experience? So those are my thoughts. Some of the things to keep on your mind. The The other part of these is the legality side, and that is making sure that we're consistent in taking notes. I know that that one can be really annoying for a lot of us, having to keep notes, especially when the whole idea of soap notes and pulling that up and really making sure you've got all of the detail and the evidence that supports what you were doing inside of your soap notes. That didn't really start happening a lot up here in Canada until, well, I mean, you could start saying somewhere in the 70s, but even then, I would say not until the 90s did it get to be. I'm sure that some places, so please, I'm not saying this for everyone across the board. I'm sure that some places were very adamant about keeping really good notes. But a lot of places that employ massage therapists or contract massage therapists, it's not on their priority list, right? What's on their priority list is getting the people in, getting them treated, getting their money, getting them out, right? But for us, we have to think on the legal side of things. We need those really good records. Those really good records are the things that keep us safe. Again, safety. We end this little part of the discussion with safety again. Keeps us safe from attacks that are unwarranted from clients, right? And it helps us even if it is warranted. So if something did happen that was unexpected and they decide they're going to blame it on you, they're going to combat you, you have your notes and you go, well, this is the evidence behind it. This is why we chose to do it this way, right? You need to have that. And sometimes you'll be able to look at it and go, you know what? I was wrong. I shouldn't have done it like that. I should have thought differently about how I was going to do this. But if you don't have those, you don't have anything to protect you. You don't have any backing, nothing. So that kind of brings us back to safety. But the other principles are the actual principles of the massage treatment, not of massage therapy and being a therapist, but of the actual treatment when you get in there. There are the big four and then the two transitionals. The big four, starting with the two that everybody knows just off the top of their heads: superficial, deep, superficial, right? So going from a more superficial surface of the body when we're treating to warm that up, to go through the layers into the deeper layers, and then flushing that out, right? The other one is general, specific, general, which we do at the same time. And that is starting with the big picture of the body, the big area, big picture, doing general treatments like effleurage and stroking, and then going into more deep treatments or specific treatments, which usually coincides with more deep treatment. But those more specific treatments, which can be superficial, those ones like trigger point therapy or adhesions, anything that's going to be like deep muscle stripping, those are more specific techniques. Joint mobilizations and the like as well. Cupping therapy, it's also very specific, unless you're doing the gliding cups, in which case it's more of a general technique. Unless with the gliding, you're going pretty deep with it, and then it becomes more specific. So those two kind of work together, specific and superficial, moving into deep areas with being able to be more specific of what you're treating, and then flushing that back out into general, more specific areas, general, more superficial areas. Now, I know a lot of you guys already know this. You're already so comfortable with those two. And for the most part, I think that most people do follow these. The only one that I seem to have seen difficulties with sometimes is the superficial, deep, superficial. A lot of people will just start going in deep without the body being warmed up or ready at all. And if you were here, I think it was last week, it might have been the week before, but Cora and I were talking about the fact that the body has a response to any sort of touch to it, and that response is always going to be a vasoconstriction response. And that means those small blood vessels under whatever is being touched constrict, shunting blood away from that area and setting the body into the beginnings of a sympathetic division response, right? Or a fight and flight response in the body. What we do then, of course, is get them back into a rest and digest by not taking our hands off so that we don't have to put them back on again. But taking them away from that and putting them back into a rest and digest with breathing and whatnot. If you decide to start deep without warming up the area, without giving their body that sense of calm and rest, then you're going in, their sympathetic division is going to start firing, their fight or flight responses are going to start happening on a neurological and a hormonal side. So the chemical side does come into play a lot, actually, with this. The big thing that might happen then is whatever you're working on, the muscles around could start to spasm, especially if you cause pain. Right? But even without pain, the muscle spasm could happen because you've sent them into a sympathetic response. So, just a thought process for those of you who have a tendency to have deeper treatments. Don't forget that you got to get that top layer relaxed, and you've got to get them into a place where they can respond to your treatment in a way that's healthy for their body, instead of responding with muscle spasms and fight or flight responses. That is the majority of what we do as massage therapists, is to try and take them out of the fight or flight. I know that there are times where we do deeper, harder, more painful type techniques, but it should not be at the expense of their well-being in the moment. Again, just massage therapists, so a lot of that, what was just said, was more my opinion than anything. But superficial, deep superficial does keep you away from the potential of harming your client better than if you were to just go straight in deep. Now, there is also the proximal, distal proximal. So that is working from a proximal point to the thorax and moving out to the distal parts and coming back up. Doesn't really jive all that much with the thoracic region, since it all just goes into one central chamber to go up to the heart. Right? So with the head, we do it. We start down at the neck, then we come up. With the arms, we do it. We start at the shoulder, move our way down, and then, of course, come back. And then the legs as well. We start at the hip, move all the way down, and then come all the way back. This allows for any sort of fluid movement that you're causing to first and foremost get all of the, anything that might be trapping fluid from moving. You're able to loosen that up, and then you can flush it back down really, really well. We don't do this with people who have major heart conditions or high blood pressure, because the heart can't handle all of that fluid movement, right? But for everybody else, it's great. Your clients may start to gulp a lot more, especially if you're doing a lot of lymphatic work. You'll notice them gulping like crazy because everything is moving, especially when you do everything up in the face and the arms. You're going to see that response. They're just like, why am I salivating so much? So it's quite fun. It's a fun thing to see. I'm sure a lot of you have already seen this and already know, but we do this, and I don't know that this is one that a lot of people forget or remember about. It's just a nice reminder. There is reasons why we do this. We don't want to just give a massage to one particular area. However, there are times, and there are always exceptions to that rule. So if you're not doing anything that's going to cause major changes in fluid levels in an area, which as massage therapists, our point techniques don't do a lot of that, right? Our point techniques don't create too much fluid movement in an area. Just our big, long stroking techniques do. So you can do things like treat the hands or the feet alone. But if you notice that they start to inflame, or if you notice they start to get a little redder than normal, or if you start seeing puffiness happen, then you do need to add in some movement up and away from there, just to avoid any sort of possibility of swelling. So those three are usually the ones everybody remembers. And then there's the fourth one, which is peripheral, central, peripheral. Generally speaking, with peripheral, central, peripheral, we're talking about a specific area that you end up getting into treating. It's a little hard to do with the whole body, and it goes against the idea of proximal, distal, proximal, because superficial, deep, peripheral, central, peripheral would think go to the ends of the body and then bring it back up and then push it back out. That's not what we mean. What it means is literally you find an area. So you've got a really big scar tissue or scarred up area, a fibrosed area, an adhesed area, or a contractured area if you want to do something like that. You're not going to just go directly into the center of it and start trying to work it out from there. It's not how collagen works. That's not how scar tissue works. What you need to do is start on the outside. If you start on the outside of whatever it is that you're looking at, you'll actually start to release the fibers, release the collagen, release some fluid into the area that needs to be there. And then you can go to the next, and then to the next layer, in and in and in and in until you get to that central point. Now, this is not true for trigger point therapy, but for anything like adhesions, or if you're doing deep muscle stripping and it is specifically something like a scar or scar tissue, or if it's a really highly fibrosed area, or if you have contracture that's happening in a particular muscle, then you want to focus on going on the outside, coming to the center, and then going back out to the outsides. Now, I know a lot of you already knew that too, but it's nice to refresh and review a little bit. Now, those are your big four. The other two, they have a lot of exceptions, but they are here, and it's a good thing to keep in mind. The first one is pressure towards the heart. Right? So generally speaking, that's to avoid any sort of edema or swelling that we could create, usually in the limbs. We do want to try in our limbs, in our head, and in the torso area to be putting and pushing pressure towards the heart. Or if you would, pressure towards the lymph nodes if you're doing lymph, which will then eventually have pressure towards the heart. If you are unsure of where lymph nodes are, if you haven't really gotten into the lymphatic drainage side of things yet, this one really does give us a good guidance to start that round. So MLD, such an amazing type of therapy. Definitely look up and see if there's anybody who's offering courses for manual lymphatic drainage. If you're from Saskatoon, Elena, I can't remember the name of her new business. Oh no, Elena, I'm sorry, I forgot her name. Maybe I'll just quickly look it up. But she does courses on manual lymphatic drainage, and they are amazing. I'm just going to look up here. River Birch. Oh my gosh. You know, I see it all the time. She's great on social media, so I can never, I don't know why. Yeah, River Birch. She is phenomenal. So yeah, look up River Birch for her courses on manual lymphatic drainage. As you can tell, CNC doesn't do the manual lymphatic drainage yet, and we may not. I actually don't know. We may leave that one, or we may talk to Elena and see whether or not she'd be interested in offering courses through us. That would be a fun one. But yeah, she is someone I can send you to in the Saskatoon area. I know we don't have a lot in the Saskatoon area when it comes to continuing education courses yet. That's what we are doing. CNC, we're really trying to, for Saskatchewan, build up a lot more courses that are available to you. And then, of course, we're going to be able to offer them outside of that. But our first and foremost focus is Saskatchewan, because it's where we're from and it's what we love. Anyways, sorry, that was pressure towards the heart. Again, that one has a big no-no to it, and that is when somebody has got a major heart issue, like chronic congestive heart failure, or if they've suffered more than just a minor heart attack. And even with people who have suffered minor heart attacks, we're a little bit more cautious. High blood pressure, low blood pressure, anything that has to do with the heart and the blood vessels, we are being a lot more cautious, and we're not always pushing the pressure up towards the heart. So my thing is, for every down, I do 2 up for pressure towards the heart. And if it's somebody that I can't do that, if I do have 1 up, I will do 2 down or 2 sideways to make sure that it combats some of that. The last one is always treat the antagonist. ATTA. ATA. Always treat the antagonist. So basically, a lot of us don't feel that we have enough time to truly treat everything that needs to be treated in a session. So always treating the antagonist can be really, really hard. But don't forget that treating the antagonist does not necessarily mean on the table. If you want to, you can treat the antagonist with home care as well. And even be like, can I see you do that so that I know that you're doing it correctly? Can you try this with me so that I can make sure you're doing it right? And at the very least, then the antagonists are going to get a little bit of treatment because you're doing it with them. Or if you want to do them during treatment because you have the time or you think it's really important, there are some things that are a little bit shorter and easier. You can do, instead of doing your whole route and whole round of your effleurage and stuff to follow your techniques and treatments, because you've already put them in a good relaxation state. And if you're working on the agonist, the antagonist is also going to get some of those effects already. You can go in with a counter strain technique or a positional release technique for that particular muscle or group of muscles. You can put them into a position where they're at their least strained, right, their most relaxed point, and just sit them there. And then you can go in if you want, and you can do a little bit of stripping, light stripping in the area, and that antagonistic side will get the treatment that it needs. It doesn't need the full treatment. And I think that's something that a lot of people forget. Unless you find things, of course, if you do find things, then you need to talk to your client, talk to your patient, and be like, okay, so I also found this stuff. We don't have enough time to treat it today. Or, hey, I found this over here. I know we wanted to do this treatment as well, but you would benefit more from this right now, and we can do that on another treatment, or we can extend your time. And talk with your clients that way. It's just, just some thoughts. So yeah, that's it. That was the whole thing today, was just talk about those principles again, put them out there. If you're feeling attacked by any of this, it likely means that you haven't been doing some of it, and fair point. We're not trying to tell you what to do or attack anybody, just reminding you of the absolute basics. Sometimes we need a good reminder and a refresher. Speaking of refreshers, that is what we have with our upcoming live webinars. We have refreshers for a lot of the systems of the body, so the anatomy and physiology of them. If you want to go on to cnclh.com/in-person courses, or if you just want to go there to cnclh.com and then click on the in-person courses, you're going to see what we have to offer. On the front page, you can scroll down and just look at the calendar if you want, and the calendar will tell you what is coming. And yeah, we're going to be going through the first half of the month is focused on nerves as well as endocrine system together, and then blood and urinary system and circulatory system all working together because they're all about blood. The second half of the month is going to be, what is the second half of the month? Oh, integumentary system and digestive system together. I know it's a weird one, but trust me, it makes sense. And then lymph and immune system. So those are going to be the second half of the month. I always do them on Tuesdays and Wednesdays. And then at the end of the month of March, we will have some actual in-person courses up and running and going. And we'll have the blending courses as well for the massage oils, the blending courses and kits. Stay tuned for that. I'm not doing the full announcement here. We're going to do an announcement live probably in 2 weeks time, maybe a week, depending on our desired timelines, so that you can get to know what we are doing come the springtime, which is right around the corner. So yay, spring is coming. We wanted to make sure we had quite a few of these available and ready to go for spring. So that's it. This is perfect timing. It's been basically half an hour. I'm going to head out of here. I hope you have a really fantastic night. And if you're watching this later, a fantastic morning, afternoon, evening, night, whatever it might be. See you later.